a medical doctor specialized in public health medicine. She works independently as a clinical epidemiologist and also chief specialist at the South African Medical Research Council. And she leads a College of Public Health Medicine COVID-19 evidence-based task team, that's a mouthful, which produced the school guidance that was shared with the PFP principals earlier. And I don't know how many of you might have received that school guidance on how to reopen schools safely. In May, Nandi was invited to input into the Ministerial Advisory Committee regarding schools opening. So we have really someone here who's got a lot of expertise and a lot of knowledge from the medical side really on the pandemic. And what's nice about Nandi is that she's making it very accessible to people who are not scientifically clued. So it's I'm very exciting. Nandi, welcome to you. And I'm going to stop sharing my screen so that you can share your own presentation, and I'm handing over to you with much gratitude and excitement.
In discussion with Magali and Nonhlanhla, we decided that I would speak as briefly as possible so that we can have as maximum amount of time available for questions. And as Magali said, you can just write it in the chat. I'm not going to actively follow the chat right now, but she'll be collating and we can talk about your questions at the end of the session. So I'm hoping for about a 12 to... Yes?
Sorry, Nandi, just a correction. Please use the Q&A function rather than the chat, because it's easier to track the questions in a Q&A. Okay.
All right, so ignore what I said and use the quick Q&A as Magali said. So I'm going to aim for about 12 to 15-minute presentation, and then I think we'll have the next presentation, but then do put your questions down so that we capture them and I can address them afterwards. So what I thought today would be most useful, rather than looking at specifics, which I understand the speaker following me is going to be talking about, but to really talk about a principled approach based on what we know about the science and why understanding the science of COVID-19 is important for everyone, but specifically for principals and schools, and how this understanding can actually help us keep schools safer. So what I'm going to talk about is very briefly what SARS-CoV-2 is, and I have taken the foundation of this presentation that all of you are aware of the epidemic, how it evolved in China, how it became a pandemic, and how it's affecting us now in South Africa. So I'm not going to spend a lot of time on that. I am going to just go into a little bit of detail about how it's transmitted. And then I'm going to focus on children. Obviously, children are not the only people in schools. There are adults, there are teaching staff, there's support staff. But my focus today will be specifically on children, and we can talk in the question and answer around other issues around adults more, if you so wish. So I'm going to talk about how children are affected, what the transmission risk is in schools, how we can reduce the transmission in schools using the science, and then some pointers just to what we should be telling learners before opening it up to questions. So what is it? So SARS-CoV-2 is a coronavirus. I'm sure you're all aware of that, which is an RNA virus. All I really want you to take away from this particular picture, except for those of you who've trained in biology and will be immediately familiar with it, is that it has a lipid membrane, a fatty layer which covers it. And I'll come back to this when we talk about why that's important for reducing transmission. So how is it transmitted? The virus lives in our respiratory tract and in little droplets which we can sneeze out, cough out, and importantly, breathe out as well. When you sneeze or cough or breathe heavily, or when you touch your mouth and then touch something else, somebody else can either inhale those droplets, or they can touch a surface which has been contaminated by virus and then touch their nose, their mouth, and importantly, the eyes. We very often forget that the eyes are an important route of infection into the body. And perhaps, yeah, let me go on to this. So this is a very interesting study that has been done by Department of Engineering at the University of Edinburgh. It hasn't been peer reviewed yet, but it is out and available. If you follow that link, you can read the full study. But if we look at normal breathing, this is the air you're displacing, and you can see it actually goes about 35 centimeters, a little bit more. And we always say that 1 meter distance has been important, and to ensure it, we talk about a 1.5 meter distance between your droplets landing on somebody else. But if we look at heavy breathing, you can see they are propelled much more strongly, and those droplets coming out of your mouth can go much further. And then finally, if you cough, there's a very rapid propulsion of the droplets going out. When we wear a mask, obviously, some of that forward direction is reduced, but one of the concerns we have about masks is that it can still go out the top. Those of you who've been struggling wearing glasses with masks will already be aware of the condensation and how your glasses fog up. So the droplets and the air is still escaping up and out, and it has some concerns around when we tell individuals to cough into their nose, into their elbow while they're wearing a mask, that a lot of that propulsion can come out the side. So while I am going to talk to you about masks in a little bit of detail, I'm just bringing that up at this point so we know, having looked at these images, where the concerns are around masks and why we can't rely only on masks. In terms of the symptoms of COVID, we know the classic ones like fever, a cough, a sore throat, shortness of breath. But increasingly, as I'm sure you're all aware and have read widely in the media, there are more and more strange ways that the illness manifests, including a loss of taste, a loss of smell. We've seen kids starting to develop rashes, little chilblain-like outbreaks on toes, blood clots. All sorts of things seem to be related to how this virus presents. When it comes to children, I need to say at the outset that our knowledge is evolving. Our understanding is increasing, but it is important to note that it is incomplete at this stage. We don't know everything about the virus yet and the illness it causes, and we learn new things every day. And I think people get a little bit frustrated because they hear the World Health Organization saying one thing and then changing around and saying something else. But I think if we take it that the science is evolving, and part of science is about testing and developing hypotheses and then disprove or proving that those might not be the case. That's how science evolves. So this is a natural progression. The only problem is we've seen it condensed into a very short period of time. So sometimes it appears like what we are learning and what our knowledge is inconsistent, but it's part of that process. However, taken back to China and the last 6 months now, we do see that children have a very mild illness or are asymptomatic. When it comes to the percentage of confirmed cases, it seems to be consistent in people under the age of 18 that it's around 2% or less. And very importantly, complications are less common, far less common among children compared with adults, and death is very rare. It does happen, but it is rare. And in fact, of the 30,000 people we know about in Italy, none of them were children. There were no deaths in children in Italy. So what is the risk in schools? When we closed the schools in March, at the end of March, we did this because we had data from previous influenza outbreaks and from the SARS infection from a couple of years ago. And we had no way of judging how SARS-CoV-2 would present. So we closed the schools in mitigation to reduce possible transmission. Since then, several household studies where children and adults in one household are tested have found that in general, it seems that children are not the ones who are spreading the disease to other children or to adults. Now we have a very important study which has come out of 15 schools, 10 high schools, and 5 primary schools from Australia. I'm going to show you some images of that study because I think it's very important, and we're hoping to be able to replicate something like this in South Africa. But this study suggests that children in the school environment are not major transmitters or spreaders of the virus, either to each other or to adults. But we do need more studies as schools open from around the world so that we can collate these together and pool the results and see what is actually happening in the school setting. So we will need to monitor our schools. And as I said, we're hoping to try and get some studying done around this type of question. So let's have a look at this particular school. What they did here, what you're looking at now is little green and blue figures, which represent, the green represents students or learners, and the blue represents staff. And each one of these blocks is a separate high school. In each of these high schools, there were cases, either 1 or 2 cases at the child or at the adult level. Cases are represented with a circle around them. I guess I can use my cursor, hopefully you can see that. So if we have a look at this school, we see 2 cases. All of these green learners and blue staff were considered close contacts of these 2 cases. A lot of people were followed up. They were quarantined. Then if they developed symptoms, they were tested. And out of all of these cases, there was only 1 secondary student case. This is very reassuring. It suggests to us that in schools, children are not major transmitters. Similarly, in the primary school setting, the same story, there was only 1 secondary student case. I must say that this happened from March through to May. During that period, the schools were closed after about 4 weeks, and there was a period leading up to that period that parents might have chosen not to send their children to school. But overall, this is the first such study that we have that really gives us, not that we understand why, but it really gives us some indication that schools might not be this transmission hotspot as we initially thought they were when the epidemic started out. So how do we reduce transmission in schools? As Magali said, we at the College of Public Health Medicine worked very hard on trying to put all the evidence together from all around the world to work at what were the key things that need to be done in the school transmission. And we published that, and it's available on the College of Medicine website. We published that on the 30th of April, and were then subsequently invited to join the Ministerial Advisory Committee, which inputs at the Department of Health level, which then goes to the Department of Basic Education. So some, not all of our recommendations were included, and you will see that some of them have been transferred into the DBE standard operating procedures. But really the key things that come out of this are to keep yourself at home if you are sick. That avoids screening. Keep your physical distance from others, and note that I'm using the term physical distance. We're trying to change the terminology from social distancing to physical distancing because we don't want social interactions to reduce. We want those to continue, be it virtually through what we're doing today, and that it's only the physical distance, because obviously being apart from each other as social beings is hugely affecting on our mental health. So we want to consciously move away from saying social distancing, keep in contact with your loved ones, but keep physically away from them. Keep washing your hands for 20 seconds, and in the school environment, it's very helpful to know that that takes 20 seconds is how long it takes to sing happy birthday twice. And importantly, keep away if you cough or sneeze. And if you do, do so into your elbow, despite what I said earlier about masks. So this is really my takeaway slide from the presentation today. When we plan and look at occupational health and safety in the workplace or in any closed environment, we have a hierarchy of controls. And we start with engineering controls at the bottom. What are these? In the school environment, this would be our ventilation, keeping windows open. I know it's very cold at the moment, but this is really important to do. and distancing. And here we recommend that as far as possible, schools use marking tape to show where children should be standing, where they should be sitting, and where they should or shouldn't be having their lunch outside, so that you try and, as far as possible, to indicate 1.5 meters, at ideally 1 meter if you do not have that space. Following engineering controls, we move to administrative controls. These are the things like hand hygiene, so having either a place to wash hands or sanitizer, if available, at the entrance and at the exit of classrooms. Timetabling, extremely important. Either staggering classes, ensuring that not all the kids are in the playground at the same time. One of the solutions that can work very well in primary schools, and I realize this is harder in the high school environment, is to ensure that the teacher walks from class to class rather than the children moving, so you limit those contact points in the passageways. Frequent cleaning. We talk a lot about deep cleaning and decontamination. These are not particularly helpful ways to think about the virus. Let's go back to that virus and its lipid layer. It has a fatty layer around it. So if you are washing up your pots and pans which have grease on them, you wash them. If you just wash them in cold or water, that grease isn't going to go away. But if you add the dishwashing liquid or soap, you'll find it will break down the fatty layer. And that's exactly what happens with the virus's outer layer. If we clean frequently, we get rid of that fatty layer, and that means that the virus has no way of entering into somebody else's body, because it needs that outer layer to do that. Frequent cleaning is all that is required of high-touch surfaces. Those are your door handles, the desks where the kids are working, the bathrooms, the taps, etc., etc. So this is frequent and regular, as opposed to constantly having to think about decontamination and disinfection. And I worked with the unions quite a bit before the schools opened to try and increase the understanding around this, and particularly the fact that schools had been empty for a long time. So the virus can't live for more than a couple of days maximally, and we don't even know if it's viable after that time on surfaces. So we didn't have concerns that schools would be contaminated when we opened them, because they'd been empty for so long. Once you bring the kids in and they touch things, and it's going to be difficult to teach them, but they're going to have to try not to. We need to get frequent cleaning on the go. And then lastly, screening. Going back to our particular guidance, we really recommended that schools work in partnership with caregivers, with parents, with grandparents, with the household, and get the message across that if you every morning take a couple of minutes with your child to talk to them about how they feel, not only about a fever and a sore throat and a cough, but whether their tummy is sore, whether they have any aches or pains or concerns, and wherever possible, if you can keep them at home. Because if we remove other illnesses from the school system, it will reduce the amount of other infections we see and have, but which will confuse the picture around COVID. So in the school setting, one's going to treat anybody with a fever of any sort or any symptoms as possibly COVID, and they'll need to be isolated until they're fetched, etc. So if your child is not feeling well, we would advocate keep your child at home. And then obviously when you do get to school, the DBE has said screening has to take place, and that's about asking those very specific questions around the classic COVID symptoms. But bear in mind, we know that many individuals, children and adults, can be asymptomatic, so the temperatures will also be taken. Again, the temperature scan is not foolproof. It can only pick up if somebody has a temperature, and many people won't. Last on this hierarchy is PPE. Masks and shields are to be worn. They're mandated now. But if you have a look at this hierarchy, if you have engineering controls in place and you have administrative controls in place, you arguably are keeping your learners safe. And PPE is then a nice to have. It is not the other way around. We do not start with PPE, we end with PPE. So engineering controls and administrative controls are what are key in keeping our schools safe. What to tell the learners? We suggest adopting a name it to tame it approach. They're all going to be worried. They're worried as they come back to school. Everybody knows about this. So it's good for teachers to talk to the children to find out what their specific worries are, to understand those better, and then make a plan to address them. One of the things, and again, it's not possible in all settings, but a lot of children have felt very comfortable when they come home, that they put their suitcase down or their satchel down, and as far as possible, we'd like to limit them taking too many books to school as well. And then they take their shoes off at the doorway, and they take their outer clothes off, and then change immediately into their home clothes, so that we have this process of leaving the school behind and coming into the safer space of the home and not letting the virus come in. I'm not suggesting that the virus is all over your clothes. It's just, it could be, but it's a process, and it can help a lot of the children's anxiety if they're worried about going back to school. And so we're really recommending that we use knowledge as a tool, and specifically for the little ones, although it helps understanding of all of us, is the glitter analogy. If we imagine the virus as glitter on our hands, and we all know how sticky glitter is, if you touch your nose and touch something else, the glitter sticks on your nose, then it sticks on the table. If you have red glitter and somebody else has green glitter and you touch your hands together, it all mixes up. And this is a very good way of explaining to children how the germs spread, but it's also a way of turning the whole narrative on its head, so that when kids go to school, they don't go to school in an atmosphere of fear and policing, thinking, I don't want to catch corona. They go to school thinking, if I had corona, how would I stop passing on the glitter to my friends? How would I stop passing on the glitter to my teachers? And in that way, it helps instill some individual responsibility for behavior, as well as just making the school and the approach a little bit less severe, so that we're all looking out for each other rather than just looking out for ourselves. So just to conclude, 5 reassuring facts about COVID from the science. We know what it is. It's an RNA virus. It's easy to get rid of if you wash in soapy water. We know how it spreads, through droplets primarily, person to person. We know how to detect it. We have a test which is pretty good at detecting it. We know what to expect in terms of the caseload on our hospitals from what we've seen elsewhere, and we know what precautions to take. And they're not very complicated, although they're not necessarily easy to implement. They are fairly simple, trying to stay a certain distance from each other and washing hands regularly. So there was a UN policy brief which was published a couple of weeks ago about the impact of COVID on children, and says that although children are not the face of this pandemic, they do risk being among the biggest victims. And that's really a reflection of not having school, not having the social interaction, for many kids not getting the school feeding program, not having any other healthcare checks. So this generation of children, we need to get back to school, and we need to get them understanding how the virus spreads and how we can reduce it, because we're very certain it's going to be around for a while. And the vaccine, some promising work, but not anytime soon. I've just posted a list of resources. If Magali and Onshlanshla want to send my slides out, that's where you can find the various guidances. And yeah, then we can hand over to questions.